All right. Hello, and thank you everyone for joining us. The Southeast Mental Health Technology Transfer Center is pleased to present today's webinar event, Achieving Health Equity, Why Frontline Mental Health Workers Matter. My name is Emily Moore, and joining me in moderating today's event is Dr. Benjamin Druss, Director of the Southeast Mental Health Technology Transfer Center. Please note that the work of our center is supported by a grant from the Substance Abuse and Mental Health Services Administration, or SAMHSA. Please also note that our center and the larger MHTTC network use affirming, respectful, and recovery-oriented language in all activities. A little about our center. The Southeast Mental Health Technology Transfer Center is proud to serve the 8 states in HHS Region 4. Our expertise in public health programs, systems, research, and evaluation provides a unique lens through which we can address mental health priorities. We encourage you to visit the Southeast MHTTC website, mhttcnetwork.org/southeast, to learn more about our center and upcoming events. A few important notes before today's webinar. This event is being recorded and will be made available on our website for on-demand viewing soon. We encourage you to share your comments throughout the presentation using the chat feature. Please remember to select Chat with all attendees if you would like to share your thoughts with everyone. We have allotted time at the end of our presentation to answer questions. Please submit your question for our presenter by using the Q&A feature at the bottom of your screen. Finally, for participants who are interested, a certificate of attendance is available for download after completion of our evaluation surveys. Now, Dr. Benjamin Druss will introduce today's speaker.
Thank you, Emily. Dr. Keisha Holden, PhD, MSCR, a psychologist, is the Puissant Satcher Endowed Chair in Mental Health and Associate Director of the Satcher Health Leadership Institute at the Morehouse School of Medicine. Also at the Morehouse School of Medicine, Dr. Holden is Professor and Director of Research and Scholarship for the Department of Psychiatry and Behavioral Sciences and Professor in the Department of Community Health and Preventive Medicine. Dr. Holden earned undergraduate, master's, and doctoral degrees from Howard University in counseling psychology and completed a postdoctoral fellowship at Johns Hopkins University in both the School of Medicine and School of Public Health. She earned a Master of Science in Clinical Research degree from Morehouse School of Medicine. Prior to joining Morehouse, Dr. Holden held positions at Georgetown University, Kennedy Krieger Institute, Urban Health Institute, Children's National Medical Center, and Evaluation and Research Associates Incorporated. Dr. Holden has dedicated her career to encouraging mental health and well-being among ethnically and culturally diverse families through research, programmatic initiatives, and the development of innovative strategies for informing health policies. She's placed a special emphasis on addressing the needs of underserved and underrepresented populations that are often overlooked yet prevail in contributing to the myriad of health disparities. She aims to promote excellence in community-based clinical and translational mental health research, develop innovative programs that improve accessibility of individuals to comprehensive health care, and develop culturally centered, gender-specific, resilience-based prevention and intervention models for individuals at risk for depression. Dr. Holden is a longtime colleague, and we're just really happy to have her here today. Welcome, Dr. Holden, and thank you for being here.
Thank you so much, Dr. Druss. I appreciate that kind introduction. And so I will now shift to the presentation. I'm really excited to be here, and this talk is appropriate because it's really touching on an area or concept that is really important to me. And so when I asked about the target audience for this, learning that it was frontline mental health workers, it really encouraged me because I understand how significant the work is and continues to be when it comes to addressing mental and behavioral health topics for underserved, at-risk, or vulnerable communities across our state in Georgia, but also across the region 4. And so today we're going to focus a little bit on some of the psychosocial, sociocultural, environmental stressors that influence health disparities and health inequities, and how we can use some of those kinds, our better understanding about some of those kinds of stressors to help us determine ways to address approaches that can be used to help advance health equity. We are also going to touch on a little bit about burnout prevention because I know it's so important for us as professionals to be mindful about ways in which we can prevent burnout and ways in which we can kind of decrease stress and also just practice self-care. So I'll touch on that a little bit. So first, I want to just start out by indicating that life is truly a balancing act. We're all trying to juggle many things at home, at school, at work, in our careers, with friends, with family, etc., and trying to balance various aspects of the life that we enjoy. And of course, during this past year and a half or so, things have changed because of the pandemic. And so we've had to make a lot of modifications to adjust to how we are able to even respond to various spheres in our life. And so I just, want to acknowledge and recognize that I understand that we have this whole balancing piece that we're all trying to achieve. And of course, mental health is such an important aspect of that balancing and trying to get to a better understanding of how we are able to balance these different aspects of our lives. And I'm sure many of you have seen this definition. It comes from Health and Human Services, HHS, and it's about what mental health is. And it's so interesting because this definition was promoted years ago, but it's still relevant today. And so our understanding of mental health can really be underscored by recognizing that it is the successful performance of mental functions resulting from productive activities in ways in which we are, again, trying to balance various aspects of our life. And this is just really about our ability to adapt to change and to really respond to adversity. One of the research studies, clinical research projects that I am the PI of is centered around resilience and building resilience for women who have been diagnosed with or are at risk for PTSD. And so tapping into that resilience piece of individuals is such an important part of us being able to respond to different kinds of stimuli that we are encountering on a regular basis. But it's really about being able to function and recognizing how we can function in the face of adversity from all through the course of our entire life, from childhood to later aspects of our life. And so when we think about mental health, it's really this springboard, how we think, how we communicate, how we learn, how we interact with others, our self-esteem, etc. these are just some different stressors, and you could probably add to this list as well. But I thought it was important to identify some of the biopsychosocial cultural stressors that are experienced by different populations that we work with. On this list, health concerns, that certainly has come up even more so now that we're dealing with the COVID-19 pandemic and the relationship that it has, particularly for marginalized or vulnerable communities, which we know have a higher risk of either contracting COVID-19 or either being hospitalized for COVID-19. So health concerns, different things that a person may be dealing with in their individual life, personal issues, how they view themselves, their identity, body image, and so on. I mean, the list goes on and on. And certainly when it comes to being able to interact with others, interpersonal concerns or intimate relationship issues come up as a stressor or maybe a stressor. Family relationships, unresolved pain and trauma, negative life events, confronting negative historical stereotypes, sociopolitical stressors such as racism, sexism, and so on. And the thing that's so interesting about this is that usually, as you know, many of these stressors are not going to happen one after the other or in isolation, one at a time. It's typically a combination of stressors that happen simultaneously. And so when you think about the people that you work with, they are dealing with trying to balance these various stressors that come from several different aspects of in their life, that several different areas in their life. So I just want to shift now to because there has been this perception that health is really about healthcare only. And I just want to acknowledge that it's not owned exclusively. Yes, healthcare is a very important part of health, but we have to dig deeper into aspects of health to truly, and mental health, to truly understand some of the nuances that we know contribute to us having a healthy lifestyle or not having a healthy lifestyle. So yes, access to care and being able to be connected to care is critical, is paramount, but it is not the only aspect that we need to be mindful about. And I'm sure many of you have seen some variation of this slide or this chart, pie chart before, but it's really, it breaks down aspects that or factors that influence health status. And the thing that's really most interesting to me, certainly healthcare is important, environment is important, and human biology is important. But as you see, 51%, approximately 51% of this pie is lifestyle or behaviors, choices that people engage in or not engage in. And this is where you may see the smoking, the overeating, drug use, abuse, dependency, etc. And so the good thing about it is this is a slice of the pie that we can change, that we can work with our various individuals, families, communities on changing or shifting so that it can be modified to some extent. Said another way, or in tandem, 40% of premature deaths in the United States are due to behaviors. And some of these kinds of behaviors are, again, the healthy eating or not healthy or unhealthy eating, the stress that may be associated with that, diet, exercise, or lack thereof, the exercise, having a sedentary lifestyle, mental health, behavior health, those are also all important. And this, even though this says 40%, the last slide said 51%, and depending on what source you use, it can fluctuate, but the bottom line is that it is a large percentage of being able to have an aspect that we can influence or change or modify mental and behavioral health. And so that is so critical for mental health workers such as yourself, because you really have a significant role in how to help individuals and families shift the way they engage in certain kinds of behaviors that can contribute to their overall health and wellness. So when it comes to health disparities, this is a good definition that it really comes from the CDC, and it's about how the US defines health disparities. A lot of times this is preventable, or these are preventable differences that exist in how we acknowledge the burden of disease, injury, violence, or opportunities for different communities to even achieve optimal levels of health that may be experienced by disadvantaged populations, socially disadvantaged populations. And so health disparities, we've really done a lot of work on this over the years, over many years. And so now we're moving towards health equity, which we'll get into in a moment. But just so you know, when it comes to looking more closely at the social determinants of health, we're looking at what's happening from an economic perspective, employment, income, different expenses, debt a person may have, bills, support, etc. Neighborhood, what's happening in a person's neighborhood, where they live, where they work, where they play, in their neighborhood, so to speak. What from a housing perspective, transportation, what's happening, safety, parks, etc. And so the list goes on and on. And I won't get into it so specifically, but all of these things that are indicated from economic, neighborhood, education, food, community, healthcare system, unfortunately, there are different populations, or various populations, underserved populations that are disadvantaged or have not had the same, it's not an equal kind of standing when it comes to understanding some of these aspects here that are indicated here. Social determinants of health are truly the conditions in which people are born, grow, live, work, play, that include factors that's indicated here. And so it's really a network of topics or entities that really contribute to some of the disparities, many of the disparities that we see. Again, it's not everyone has, or different populations have all of these constellation of issues or problems, but overwhelmingly vulnerable communities, marginalized communities experience these issues, either 1, 2, 3, 4, all of them. It may be different depending on what community you're working with. Again, here is another way in which it is demonstrated, but really, again, you can group it into several domains around economics, education, healthcare, neighborhood and built environment, and social and community context. These are just some of the major, larger pools that can be used to kind of group some of the social determinants of health. And so when it comes to health equity, we're looking at ways in which we can support families, communities to reach their highest level of health. We really want us to value how we can work with communities so that we can achieve more the optimal level of health. And this is going to be different for different communities that you work with, different individuals, different families that you work with, but it's really an ongoing effort. And so I would like to achieve health equity, but it's more we're working towards advancing health equity because it's a process, it's different steps that we're going through. I like this slide because it's a good depiction of health equity, and because some people get confused about equality and equity. It's not a one size fits all approach that we need to take. Equity is truly about giving people what they need when they need it and in the amount that they need it. And so again, it's not a one size fits all. You got to tailor it, and in most cases, culturally tailor approaches that you may use in order to achieve some level of equity. So as I mentioned earlier, equity is truly a process. It can be viewed as a process and as an outcome, but we know that it's this process of reducing disparities in health and its determinants. And so that means getting deeper into what's happening with that particular person, with that particular family member, with that particular community, to truly kind of disentangle some of the determinants of health. And that's how you get to a point of being able to advance health equity. It's a process where we're constantly evolving and continuing to grow in. And I think mental health workers, you have a significant role because you're at the front line. You hear, you see, you are experiencing the stories of what it is, what people are really going through. And that's a critical part of it. So I'm not going to belabor the point, but health inequities is really, again, about these differences from a social advantage perspective, or differences that are rooted in social disadvantages and are therefore somewhat unjust and unavoidable. And so we know that different groups, as I mentioned earlier, different populations or groups of people are systematically disadvantaged when it comes to different kinds of opportunities. I do want to touch on a little bit about racism. This is I would say a hot topic, so to speak, right now. I think given some of the situations that we've all experienced in different ways, whether it be witnessing the murder of George Floyd or our Breonna Taylor situation, there are different ways in which we can understand racism. Dr. Jones is probably one of the leading thought leaders when it comes to deconstructing racism. And so I like to use her definitions and her conceptualization of racism whenever I'm talking about it, because it really comes from an understanding about it being systematic, or a system of structuring opportunities and assigning value based on that particular group or population. And as we know, many of these individuals are people who look like me, who are Black, are brown, or marginalized, or disadvantaged. So again, racism is truly a system that we have to really understand more about and deconstruct more about, so that we can get a better sense of what it means, what racism means. And so Dr. Jones has broken down racism to be several different types or levels, and how it operates. It may be structural racism, and this is about systems and social structures that produce cumulative, durable, race-based inequalities. It may be institutional, and she has indicated that this is about the policies and practices, procedures that are in place among different institutions that really disproportionately impact racial minorities and their ability to fully produce or be at their optimal level of productivity, and in turn that be able to achieve the optimal level of health. Individually mediated racism. This is more individual, where racial bias, treating individuals from other racial groups poorly or in a discriminatory manner. That's individualized or individually mediated racism. And finally, internalized racism. And this has more to do with how an individual, well, not, excuse me, let me go back. Internalized racism. This has more to do with how a person may internalize certain aspects of themselves, or having this notion of someone else having different kinds of experiences that can negatively impact them. And this may be, for example, someone thinking that another person's ice is colder than their own. So really understanding this internalized. Again, there's a lot of overlap between internalized and individual, but just understand that well, Dr. Jones has broken this down this way, and I like it. So I do want to acknowledge, as I've been talking about health equity and health disparities, they're really intimately related or intimately involved with each other. And really, as I mentioned earlier, a lot of health disparities or health inequities stem from health disparities. And we know these differences that exist in the different groups that we work with and communities that we work with may contribute to having unequal positions of power, unequal opportunities, and these things are unavoidable and unjust. Health equity is really looking more closely at the ethical and human rights aspects of principles that we talked about that motivate us to help eliminate health disparities. So again, if we are able to reduce and ultimately eliminate disparities in health, that's going to be a central component to being able to achieve health equity or advance health equity to some extent. So when it comes to achieving health equity, I just believe that mental health workers in particular have to position yourselves as a force for achieving health equity by looking at ways, finding ways to make concrete improvements. It's not all on you. It's definitely a combination between policymakers, those who are in various positions, different organizations, academic institutions, etc. But I think that as mental health workers, as I mentioned earlier, you have the opportunity of truly getting the true story or experience of what people are dealing with. And so being able to take that information and share it with others and share it with those who are in positions, that decision-making positions, can help with this overall goal that we have of achieving health equity. some of the ways that we can get even deeper into it is looking more closely at research that's being conducted, making sure that BIPOC or Black, Indigenous, people of color are a part of research studies, advocacy ways in which we are able to identify, provide information to policymakers so that advocacy can be made on behalf of those communities that may be voiceless in some ways. Education and training. So if we're working with different students or those who are actually working with communities, we have to train them, provide the appropriate education. And of course, practice is critical here as well. We want to make sure that we are practicing what we preach and that the kind of ways in which we are helping to modify the behaviors of the individuals that we work with, our practice is appropriate. It's culturally centered, it's culturally tailored, it's linguistically centered, linguistically tailored, it's appropriate. And I would just say if there are things that you are not aware of or don't know about a particular community, just ask. Find, the best way is to identify individuals who are in that community and that partner that we may actually have partners with, collaborations with, and become more knowledgeable about it. Again, in education, training, practice, advocacy, research, all of these things work together so that we are able to achieve health equity. So some general recommendations that I have indicated on this slide for really having a more equitable mental health system is to work upstream. And the next slide is going to show you upstream, midstream, downstream. But I think it's important for us to really touch on all of those different areas. But working upstream is important, addressing the social determinants, really getting deeper into what some of the reasons are behind these determinants, embedding services in places that people go. And so this is about taking the services to the communities. I know at Morehouse School of Medicine, we have a mobile van. And so we go through different communities such that we're not just sitting waiting for people to come to, we want them to come to the primary health care center, but we also are taking services to them as well. Empowering people to be healthy. I was a part of a project that was called Healthy Corner Store Initiative, and this was about bringing healthy fruits and vegetables or fruits and vegetables to corner stores, knowing that many community members that we work with may actually go to these corner stores, and some communities they're called bodegas. And so being able to empower people to recognize that they can actually, in some cases, get access to healthier foods. I know that there are some food deserts in different areas, so that can be an issue as well. And that's one of the contributors to some of the social determinants of health that we have identified. Working with people who are healthy. I think this is about modeling, especially as frontline mental health workers, you want to be able to model some level of health. And this is through your choices, your behaviors, so what you do, so that it has a way of translating. Dr. Dress mentioned that I'm a psychologist, and so so many aspects of what I think about and the work that I do is about trying to encourage behavior change. And modeling that behavior is a big part of that as well. And so I would imagine too, as mental health workers, that's an important piece as well for you. Broadening the set of interventions that are used. And again, this is about having those individuals who may not traditionally be in interventions or a part of interventions, clinical interventions, to be sought after or recruited to be a part of the interventions. It's not appropriate to just say, okay, this worked in this community, so it should work. It worked in A community, so it should work in this other B community. So being able to really listen to individuals and communities and tailor interventions to be appropriate for that particular community. Looking at others to really broaden literacy when it comes to mental health. I know, at least for me, in some of the different projects that I have ongoing, I can't necessarily go in to various communities and talk to clinically. Yes, you want to be able to provide information that's accurate, but I don't start out that way. For example, I'm not going to go in and say this is a depression study. I may say this is a study that's helping to reduce stress or stressors in your life. It may influence you to be able to have a better outlook on life. And then I ease into depression or labeling depression. And I guess I'm saying this in a way because I want to make sure that it's not too overwhelming. Yes, we want to improve literacy among our different communities, but we also want to be able to be relatable, excuse me, as well. Focused on health at the community level. And this is, I've already touched on this a lot, but this is again about listening to community. We can't go in suggesting that we have all the answers or the answers that you need this, you need that, but definitely listening to what a community member or various individuals who are a part of that community may actually indicate. And again, this helps to support reframing or strengthening the mental health system. Looking at how people view mental health. Sometimes just to me, it's important to normalize it to some extent. We all have different struggles that we deal with or that we're going through. And so it may not be to the extreme of some of the things that people in different communities that we work with may be, but we can relate to them in a way that's helping people to view mental health as something that a part of all of our experiences in some ways. I mentioned upstream, midstream, and downstream. And I'll make sure that you get these slides so you can kind of, I know it's a lot of information here, but it's really about looking at the different levels of how you want to intervene or work with people. And although as mental health workers, you're not responsible for taking on all of these aspects, but we need to make sure that there are individuals who are working on mental health, behavioral health aspects at the upstream level, and this is where everyone in all communities should have some understanding about some of the conditions, issues, concerns that are facing people from a mental behavioral health perspective midstream. And this has to do with being able to move people from conditions that decrease their health and well-being to conditions that support them, and then also downstream. And this has to do with being able to encourage behaviors, understanding ways to support individuals, families, or communities to look deeper into some of the issues that may be causing the stress, contributing to some of the kinds of problems or issues that they may be experiencing. So, Dr. King gave a very good, this was many, many years ago. He gave I love this quote, of all the forms of discrimination and inequalities, injustice in health is the most shocking and inhumane. And I think this is critical because mental health, behavioral health, and overall health are intertwined. There is no way that we can separate the two. And so as we begin to understand more and more about overall health and wellness and well-being, mental and behavioral health plays such a major part of that. And mental health workers have a critical role in that as well. Okay, so now I'm going to shift a little bit to understanding a little bit about self-care, self-kindness, being self-compassionate, and really under the umbrella of reducing burnout. Excuse me. So when it comes to burnout, we all have different ways in which we're trying to avoid being burned out. But burnout really is a truly psychological syndrome of understanding that there's this emotional exhaustion, depersonalization, and reduced accomplishment. And so that's really what burnout looks like or can look like. And it's really defined as a failure or exhaustion that a person is experiencing because there's this excessive demand of energy, and they're trying to continue to produce, but there is this emotional, mental, and physical exhaustion that is taking place. And so as mental health workers, you have to be conscious about ways to prevent burnout so that you are able to help various individuals, families, and communities. And so I'm not going to go over all the aspects here. Again, you'll get these slides, but there are some long-term stress and burnout symptoms from a physical perspective, being very, very tired. Some people have aches and pains, and it's different for every person. It's not a one size fits all. Different people are going to experience different symptoms. Some people lose weight, some people gain weight. From a behavioral perspective, some people may be paranoid, some people may feel a sense of isolation, withdrawal from other people. From a mental and emotional perspective, when it comes to burnout or stress, overwhelming stress, forgetfulness may set in, crying, negative mindset, irritability, being resentful. From a spiritual perspective, being cynical, not really feeling like you're able to engage in activities or having the same sense of joy that you may have previously experienced. And so here the symptoms, or excuse me, the stages of burnout. The goal is to not get to the next stage, depending on where you fall. And so this next slide here, this slide has different screening tools that you can use to screen yourself on burnout or risk for burnout. And depending on the scale that's used, it can give you a score so you can determine what stage you could be in. Hopefully you're not in any of the stages. And again, the goal is to not progress to the next stage. So there could be a problem though, if you are experiencing extreme feelings of neglect at home, at school, at work, in the community. You recognize that you're drinking a little more, using drugs, and or engaging in risky behaviors. If anxiety is causing problems in your relationships, interpersonal relationships, that can also be a sign that there's a problem. And that can be actualized or shown in ways of having these arguments, if you're losing friends, if you're having all these conflicts that are problematic. So those are signals that there may be a problem, and not only for you, but also for people you work with as well. So here are just some other indicators. I'm gonna go through pretty quickly because I want us to get to the questions. And I've also identified some different ways that you can try to prevent stress and burnout, develop action-oriented plans. You can reduce your vulnerability and build up your resistance to stress through various ways. And you can also reduce your reaction to stress or stressors that you experience. Here's a list of things that you can do to try to prevent stress that you may be experiencing, again, with the goal of trying to prevent levels of burnout. And then finally, here are some different ways that you can help to encourage self-care. So I want to leave you with these 3 questions for you to contemplate and in your own time, how you're processing your current work or career situation, and how it contributes to your overall level of happiness. What are the strengths that you can build on to engender resilience so that you are capable, even more capable of being able to support others that you work with? And what can you specify to help you cope better in your own life? Okay, so I will turn it over to Emily. Emily, you can, if there are questions that people have indicated in the chat, or if there are other questions, I certainly will take them now.
Wonderful. Thank you so much, Dr. Holden, for that presentation. We do have 2 questions already in the Q&A feature. Again, everyone, if you have a question for Dr. Holden, please put it into the Q&A feature at the bottom of your screen. Our first question is, my agency stresses using evidence-based treatments like DBT or CBT. However, I think often these treatments and evaluations are limited to privileged groups. How can we ensure our treatments are user-friendly for marginalized individuals and communities?
Mm-hmm. Okay, so as you know, the gold standard is to have therapy, CBT, for example, in combination with medication. That's which a psychiatrist would prescribe. I subscribe to cognitive behavioral therapy, and I think that approach is relevant to communities of color or BIPOC communities. But you have to be creative in how you apply it. I think the most important thing is being able to establish a connection to your potential client or group that you're working with. I have also found strength in the resilience training that I am using for intervention, one of my clinical interventions that's targeted to Black women. And so, yes, CBT is critical. Evidence-based CBT is good. But if there's a way for you to culturally tailor it and you make sure that it's relatable to the population or people or person that you're working with, that would be key. And that may be shifting, keeping the same concept of CBT, but then modifying it such that it is more appropriate or culturally sensitive, culturally responsive. Actually, the new word, or the word now, is cultural humility, using cultural, being culturally humble to that particular community. Okay.
Okay, thank you so much. We have one more question already logged into the Q&A feature. Our counseling center in Sarasota is staffed 90% white and 10% Latino. What hiring/recruitment steps do you suggest we attempt to engage potential people of color in staff?
Mm-hmm. I can tell you that some places may not be, but community health workers that come from the community can be trained such that they are a part of your center. It may, I would suggest that there be a tag team approach where you not only have just I hate a white person, but also a Latin person or Latino, Hispanic person to be a part of a treatment plan. But to recruit those, it's hard because you may start with community health workers who are from the community, and they may not have the same, they don't have the same level of training or credentials that others may have in your particular community health center or mental health center. But there's still a role for them. So you may have to pair a community health worker with someone who is more senior. It is hard to recruit. I would talk to also those Latina, Hispanic individuals who are in that, who are already hired. They may have some good suggestions for recruitment from diverse communities as well. But I can't, I mean, to be honest, I'm not 100% sure.
Thank you, Dr. Holden. Our next question is, like many health agencies, my agency requires clinicians to bill a certain amount every month. This creates tremendous stress. Literally, people have been fired when they don't make it. How can we strike a balance between caring for ourselves and meeting these fiscal responsibilities?
Mm-hmm. This is a policy issue for sure. I know I co-chair the American Psychological Association Presidential Task Force on Health Equity, and we're looking at some of the payment models that exist across the nation when it comes to looking at some of the social issues. But this is definitely a policy issue, and it may be too where you have to pair with a social worker or someone in another field, such that you're able to bill for services that may not traditionally be. It's hard. It's a hard one. It's a definite hard one. Yeah, because it's a balance between, you know, being supportive of those who are in those fiscal responsibility stewardship positions and what they want, being able to, but also provide the kind of care and services that you know are needed. I can tell you that people who are at a point where their lights are getting turned off or they can't find food, they're not gonna be open or willing. It's going to be very difficult to get to a point of talking about some of the other kinds of traditional therapeutic approaches that we may subscribe to if there are other kinds of issues or concerns, social issues that are apparent. So this is a policy issue, but you can start small within your community mental health center or health care center, the agency, and see if there is a discussion that can be had with those who are in leadership positions about this particular topic. And I'm not saying you have to be the one to take it on per se, but someone who has the decision-making leadership savvy to look more closely at this, I would say has to be a part of the solution. It's not enough to just be a part of, okay, this is the problem, this is the problem. We've been talking about this, the problem, for many years now. And so now it's, and you raise what is another problem, but those who are in decision-making leadership positions, policy-making positions within your particular community center will have to make some changes if they want certain outcomes. I am now working on looking at the economic aspect of addressing some of these social determinants of health. And if you are able to identify, I'm not trying to add more work to you, but if there are health economists, and if you're able to find science that indicates the economic savings for being able to address some of these social issues early on, that could be at least an argument that's used to help support your position around this financial part of things. Okay.
All right, thank you so much, Dr. Holden. We have time for one more question, and I see a question's been put into the chat. One of the things I have found in my own work is that members of the Black community are experiencing a lot of trauma, and some of this is race-based trauma, but not many clinicians are trained to assess for race-based trauma, let alone treat it in a clinical setting. Do you have any suggestions or resources for clinicians to get this kind of training?
Mm-hmm. I mean, I will say that there seems to be more of an interest in companies accepting or having a diversity, equity, and inclusion officer that can touch on race to some extent. There are some authors. You could check out Kamar Jones's work. She deals with some racism topics or treatment approaches. David Williams is another person who has published on racism and health. Another person is Brenda Ingram, Dr. Brenda Ingram, and she's at University of California, I think San Francisco, and she has also published some work around trauma, racial trauma, and coping. I think she is a psychologist too. So Brenda Ingram, Kamar Jones, and David Williams are three individuals that you can kind of research some of their work to see about that topic.
All right, thank you so much, Dr. Holden. That is all of the time that we have allotted for question and answers today. Do you have any final comments or remarks before we move on to the evaluation portion of today's presentation?
That mental health workers, I want you to take care of yourselves. And so burnout is real. Some of you may have experienced it. Some of you may be experiencing it now. And so I just encourage you to take care of yourself so that you can take care of other people and support other people that you work with. Thank you.
Okay, thank you so much, Dr. Holden, for your presentation and for answering our questions. Everyone, that is going to be the end of today's webinar event. The Southeast MHTTC thanks you for your participation in today's webinar. We value your feedback and invite you to evaluate our event. Please complete a brief SAMHSA required survey by visiting the link presented on your screen. Completion of this survey will provide information to SAMHSA and assist us in planning future events. Afterwards, you will be automatically redirected to additional questions from the Southeast NHTTC regarding the impact of this event on your knowledge and skills. There you will have the opportunity to download a certificate of attendance for your records. Please allow about 5 to 10 seconds for your browser to redirect you. Again, our center appreciates your participation and feedback. Dr. Holden, we appreciate you for your presentation, for answering all of our questions. Hope you'll join us for future events. Please visit our website to learn more. This concludes today's webinar. Thank you, everyone.